The team inspected Hillingdon recently. When they went in, they found a mixture of things, so some improvements in some of the core services, but we found some real concerns in the emergency department and in surgical services, and some concerns, ongoing concerns in the outpatients departments. We did see improvements in some of the other core services that we inspected. So one of the challenges that the Trust has got is the flow of patients through their services. So the front door is obviously emergency department, not unique, those challenges by any stretch. Lots of hospitals face those same challenges of big numbers of patients coming through those front doors. The key is making sure that the patient experience throughout that journey is as good as it possibly can be, that the quality of care being given. We did see that staff were very caring in those departments, but those staff were working under pressure. And some of the challenges that they had was getting to see patients in a timely manner, and making sure that the environment in which they were cared for was clean, that staff washed their hands, that the governance around that, the checks on quality were robust enough to make sure that any areas that needed improvement were identified by the Trust themselves and steps were taken to address those. We didn't always see that was in place in a consistent way. The hands-on care that's given is really good, patient outcomes are good. I think there is room for improvement, and we have made that clear in the report to the Trust, the areas that they really need to focus on to make sure that those improvements are made.
There we go, that's the Care Quality Commission. Then let's just bring in a statement from the Chief Executive of Hillingdon Hospital's NHS Foundation Trust. Shane Degaris said that we will use this report to help us make improvements wherever they are needed, including learning from those areas within our own trust that have managed to improve their ratings. It is important now for all staff that we collectively focus on our efforts on the actions required to improve services in a sustainable way for our patients.